Hello everyone, welcome back to Easy Vet Anatomy. Myself Dr. Sharon. In today's video, I'm going to show different foramens in the equine skull. Before that, if you're watching this for the first time, don't forget to subscribe to our channel Easy Vet Anatomy for more informative videos. Let's get started. The one which is piercing the supraorbital process of the frontal bone, this is supraorbital foramen. And here you can see one more foramen. This is infraorbital foramen. Infraorbital foramen, so it leads to the another opening. That foramen is called as maxillary foramen. So this canal is infraorbital canal. So at this part you can make out one more foramen here. This foramen is called as foramen incisivum. The same incisive foramen you can appreciate on the ventral aspect here. In the horizontal part of the palatine bone, you can appreciate this foramen is major palatine foramen. And here you can see one more small foramen. This is minor palatine foramen. This part is called as maxillary hiatus, where you can appreciate three foramens. The one which is connecting the anterior palatine. So this foramen is posterior palatine foramen. And laterally you can appreciate one large foramen. This is maxillary. We have already discussed this maxillary foramen. See, it is connecting the infraorbital foramen. And this foramen is spinopalatine foramen. You can see ethmoidal foramen, which is for the passage of ethmoidal artery and nerve. Above the ethmoid, this is optic. And you can appreciate one more foramen here. So this is rotundum. And this side you can make out one more foramen. This is orbital. So this rotundum and orbital, they are separated by a thin plate of bone. And this is alar foramen, and this canal is alar canal, caudal alar foramen or large alar foramen. And at this part you can see one more foramen here. This is small alar foramen. This is caudal alar or large alar foramen. This is small alar foramen, ethmoidal foramen, optic foramen. This is rotundum, and this is orbital. So rotundum, it is for the passage of maxillary division of fifth cranial nerve. Orbital is for the passage of third, sixth and ophthalmic division of fifth cranial nerve, that is trigeminal nerve. Third being the oculomotor, sixth being the abducens, and also for the ophthalmic division of trigeminal nerve. Just beneath this supraorbital foramen, so this is the orbital rim. Here you can see the lacrimal bone. So this foramen is lacrimal foramen, which opens into the nasal cavity. So where you can appreciate the passage of the nasolacrimal duct. And the large foramen, which is seen on the posterior aspect of the skull, this is foramen magnum. This foramen, which is present in the condyloid fossa between, this is condyle and this is paramastoid process. Between the condyle and paramastoid process is the condyloid fossa. The foramen which is seen in the condyloid fossa is hypoglossal foramen for the passage of 12th cranial nerve. And this is called as foramen lacerum. So this part which is towards the posterior side, this is called as foramen lacerum posteriors or jugular foramen. And in this triangular part we can see some notches. So from medial to lateral you can see this is carotid notch, which is for the passage of the carotid artery, and oval notch, which is for the passage of mandibular division of the trigeminal nerve, And this is spinous notch, which is for the passage of middle meningeal artery. So in life, these are covered with a tough sheet of fibrous membrane. And in this part, we can make out this is retroarticular process or postglenoid process. Beneath the postglenoid process, you can see here one foramen. This is postglenoid foramen. And you can make out this external acoustic meatus. This is external acoustic process. And at this part, you can see a posterior triangular process of posterior triangular process of squamous temporal bone. And this is mastoid process. And here you can see a thin rod of bone here. This is hyoid process, paramastoid process. This structure is tympanic bulla. Between the hyoid process and the mastoid process, you can appreciate one foramen here. This foramen is stylomastoid foramen, which is the external opening of the facial canal.